Hello, can everybody hear me?
Yes.
Good. Okay, thank you. Good afternoon, everybody. On behalf of the Florida Healthcare Simulation Alliance, I want to welcome you for to this new edition of the webinar on this August for the month of August. I wanna to have a very interesting topic today, and I'm gonna forward pass it to Daisy Fuentes, who is gonna do the introduction for the our distinguished speakers for today.
Thank you. Hello, everybody. Um, since I got this job here in Mayo Clinic, my first impression was to meet Amy Allen and Liz Mattson. And they were doing this particular very nice way to um, teach slash approach patients doing the songwriting. So that's why I invite them to present to us this topic, which is very unique. So Amy Allen has been part of the Simulation Center here in Mayo Clinic in Florida since the August of 2018. She actually started as a standardized patient, and now she's the coordinator of all our standardized patient, more than 20 standardized patients that we have here. And not only that, but she becomes a simulation specialist and is coordinating that part of the operation, the simulation center. Um, she has experience in education, human resources, administration. So she has more than 25 years of experience on all those topics. And then Liz Mattson, she is a board certified music therapist and education administrator coordinator here in Mayo Clinic and the Lindra P. Daniel Center for Humanities and Medicine. The Daniels Center's mission is to integrate the arts and other diverse expressions of human culture into the healing environment. Very unique. Liz utilized her music therapy background to provide patient care, enhance learner education, and engage in research. So here are my two friends, and I'm very proud to present you guys, Amy and Liz.
Thank you so much, Daisy. That means the world to us. I'm going to go ahead and share my screen with you guys so we can present this topic with you before I try and end. Can you see my screen? I see some nods. Okay, great. So as Daisy said, I'm Liz Mattson. I'm the board certified music therapist here at Mayo Clinic, Florida, with the Lindra P. Daniel Center for Humanities and Medicine, as well as the education administration coordinator. I've been with Mayo for 6 years and with the Daniel Center for 4. So I've been really enjoying my time and getting to know Amy, who's become like a super close colleague and friend through these past few years.
Absolutely. And thanks, Liz. I started with Mayo in 2018 as a PRN standardized patient. And from the day I walked in the door, I said, this is where I need to be. This is the place that lets me use all my skills in one location. And I slowly decided I was going to learn about the technology, did some tech work, and then we had some transition of our department, and there was an opportunity for me to begin managing and mentoring and training the SPs. And that's what I do now, along with other logistical and technical coordination. That's still part of my job. It's been one of those situations where I feel like I think Liz can probably speak about this to her job too, where all our skill sets that we've been given have been given an opportunity to kind of congeal into one job description. So it's been a fun collaboration so far. So we'll tell you a little bit about what we've been doing here.
So just a little background, and for those of you who may not know, so Mayo Clinic is an enterprise center, which means that we have our origination location in Rochester, Minnesota, and we have sister sites, one in Jacksonville, Florida, and one in Phoenix, Scottsdale, Arizona. And so Humanities and Medicine, as well as the Simulation Center, are both enterprise centers. We have Mayo Clinic, Florida, named center, as well as Rochester is a named center, and Mayo Clinic, Arizona. But here in Florida, as with everything that is done at Mayo Clinic, there's always an administrative director and a medical director. So for our center, Chris Yates is my program director. She has her Master's of Arts in Medicine from the University of Florida. And our medical director is Dr. Don Musalem, who is in our cancer and integrative medicine department, and then myself.
The Simulation Center is built the same way. We have a medical director who currently, and has been for the past 8 years, is Dr. Leslie Simon. She's not only the medical director of the Simulation Center, but she's also the lead of the emergency medicine department here in Jacksonville, Florida, which kind of goes hand in hand with simulation, since a lot of the training we do revolves around emergency medicine. Gene Ritchie was the original operations manager of the Sim Center when it founded back in 2016. He took a break to work on ACH for a few years, and then in the past about 6 months, he has come back again as our operations manager when that position became available. And then I'm the operations specialist for the Sim Center.
So you guys may be wondering, well, why in the heck are we getting humanities and medicine and simulation center together here in Florida? Well, our mission statements are listed here and you're welcome to read those, but essentially the end goal of Mayo Clinic and Mayo Clinic's main primary mission is the needs of the patient come first. And there's an innate connection between humanities and medicine and simulation, whether it's the opportunities to support ongoing simulations through the arts to enhance potential opportunities for simulation, or educational opportunities just like this one.
So how did this come to be? Now, it doesn't go too far back, but we met right before COVID really hit hard. And we were in the process of starting to think about how music could be utilized further at Mayo Clinic and clinical education. And we were looking for patient programming. And I noticed Liz, I would see her pop up on our monthly education all staff meetings. And I was just drawn to her energy and her engagement with patients and using the arts. And I'm like, that is something I could really get into. And when she started talking about musicians, I said, hey, you ever need a musician? Sign me up. I'll come sing. We'll do this. Well, once we got to know each other, we realized that our goals aligned, and we started to create programs that would allow both of our departments to collaborate. In particular, we had an opportunity to utilize a population of nurses and PCTs that come and train twice a month at the Sim Center. And the nurses were looking for new and innovative ways to get information across to them, important, vital information about what you need to do when you go into a room and you do your rounds. So we had been kind of writing songs. My former supervisor and I started doing this. He went on into another opportunity and Liz jumped in, but we started writing songs that would be catchy. They would be earworms, something you'd hear in your head and sing. I don't know if you guys have ever had this experience, but have you ever been driving in the car and a song comes on that you haven't heard in 20 years, but for some reason you still know the words, right? Well, your brain, your right and left brain talk to each other. That's the strongest connection for education. So we said, let's create some songs that will let people remember what they need to remember.
So as Amy was saying, there's all this research. Everything we do here at Mayo Clinic is rooted in research. So it's evidence-based, and there's scientific reasons of why we're doing what we're doing, but specifically music and music therapy really, enhances memory, enhances retention, and has improved literacy. It leads interdisciplinary initiatives just like this one that Amy and I are involved in. And specifically for our patient care technicians and our nurses, when it comes to purposeful rounding, there's all kinds of literature behind it. It leads to improved patient experience. It leads to prevention of adverse events while patients are hospitalized. And so that enhanced what we were doing here on campus with our nursing education partners.
So how did we do that? We did that by grabbing a song that we knew, or that I had known. We had always talked about, why is this important? Well, I still know the preamble of the Constitution because of Schoolhouse Rock. So it's a song that I grew up listening to. I can still state the preamble of the Constitution because of Schoolhouse Rock. And I said, well, Schoolhouse Rock, well, there's a good stepping off point, right? So we grabbed the song Conjunction Junction and we rewrote the words to go over the 5 P's of purposeful rounding. The way we designed the study is we had 4 weeks of no musical intervention. So they did it the way they've always done it. A short video about what the 5 P's are, a little brief didactic from their instructor, and then a 5-question quiz. Liz and I then jumped in and we would perform that song live in front of the group. They would still have their didactic, and then they take the same quiz. And then the third piece was 4 weeks. These are all 4 weeks. The third piece was the song recorded, which you'll see here in a few moments, and then that quiz. Here's what happened when we saw the results.
So as Amy mentioned, the quizzes had 5 questions each. And so those were administered after our learning objectives. So the chart here you'll see, and I'll explain it a little bit further. Looking at our no intervention, which is our blue group, we took the control group that had a class size. Oh my goodness, I'm having like a break part tonight. A class size of 64 individuals, and 48 of them received 5 out of 5 questions correct, or that's 75%. Now, when you look into our intervention groups, our live and recorded, our live group had 58 individuals and 54 of them got 5 out of 5. And then our recorded intervention group had 62 individuals and 57 of them received 5 out of 5. So that number of how many people completely aced those quizzes jumped up significantly.
20%. Yep.
And so just a little bit further into those numbers, you can see the spread of how many questions were correct with our no intervention live and recorded intervention. So not only did we increase the amount of people who were completely acing those quizzes, but we also eliminated anybody who was getting 2 questions or less correct. Whereas you can see with the no intervention, there is a good spread there.
Mm-hmm.
So this mysterious song that we keep talking about, we're going to play for you now. The sound should come through. We did test it beforehand. It's about 3-ish minutes.
Yeah.
So I'm going to mute us, but we're going to be able to hear it. If you have any issues, just let me know.
The party and position, personal possessions and presentation. The paint, the party and position, personal possessions and presentation. Welcome to Skills Day, we're all gonna have a good time, learning the fun way with music and lessons that rhyme. Purposeful rounding is what we're here to see, to make your day easier. Remember these 5 P's: the paint, the party and position, personal possessions and presentation. The paint, the party and position, personal possessions and presentation. Pain is what's hurting and party is needing relief. Position is certain to help with skin integrity. Personal possession should be within arm's reach, and presentation means that the room is neat and clean. The paint, the party and position, personal possessions and presentation. The paint, the party and position, personal possessions and presentation. Now purposeful rounding is what we're here about. You're feeling the flow and you're singing, and heck, you might even shout. Purposeful rounding is what we're here to see, to make your day easier. Sing along with me. The paint, the party and position, personal possessions and presentation. The paint, the party and position, personal possessions and presentation. Oh yeah.
So sorry in advance if that gets stuck in your head for the rest of the day here. But
That's kind of the point, though, don't you think? Yeah.
exactly.
And leading to that point, well, thank you, Nelson. Leading to that point, we had begun the training. We were in the last phase of it, and a close friend of mine who was at Mayo for a treatment was hospitalized, and I went to visit her one day, and I was in there talking to her, and I noticed this PCT wander in. They wear very distinctive turquoise scrubs, and she wandered in. And I noticed she kept kind of trying to catch my eye and wave at me and look at me. And I recognized her as someone who had recently come through orientation at our center. She comes up to me right as she's getting ready to leave, and she says, "I don't want to interrupt your meeting with your friend, but I want your friend to know that the reason I do my job the way I do and that I keep track of my rounding is because I sing that song in my head all day. And I've taught it to other people in my department, and we sing it and we talk about it, and we, just talk about what a great orientation process it was." So for me, it was kind of a full circle moment where something I was teaching to a nursing population at Mayo ended up improving the care that a friend of mine was receiving at the time. So we've had several full circle moments like that where we've seen it come into play. What's next for us? Well, we're doing some national and international conference presenting. We presented just recently in LA at IMSH with our project that we just showed you in a more expanded workshop format where we actually let people design a song near the end. We resubmitted it with a different study population based on a sepsis song we're doing in 2023. We'll know shortly here whether or not we've been approved for that. And then Liz and I were also just recently asked by one of our division leads in Rochester to present at the Healthcare Simulation CNE conference, which is going to be in Rochester next year in March. And we're actually talking with Mayo Education to see if maybe we can begin making some training videos that would go into our internal My Learning curriculum website.
And then on top of all of that, we've gotten a lot of traction within internal departments asking for us to look at their learning objectives and what they're trying to test their learners with to make songs. So Dr. Simon, who
He's our medical director,
Amy mentioned earlier, medical director, emergency department physician, has a difficult airway course that she asked us to write a song to, and we did it to the tune of
Love Shack. Yeah, we got, and then we're working with nurses right now to collect new study data for our presentation in 2023. That is the song about the sepsis bundle, and we did that to the tune of Peggy Lee's Fever, which was unintentionally on purpose. And then we recently worked with our experience group here in Mayo Clinic to come up with some songs that were parodies to kind of talk to Mayo Clinic about how important it is, not only our experience as employees, but the experience of the patients. And that turned into 2 full-scale videos. We did it all on our own. We didn't have any support from media services. We wrote the song, we recorded it, we mixed it, we created the video, we put captions on it, and it's now on the video exchange at Mayo Clinic for people to see.
So this is just our references. I know we've thrown a lot at you guys. So I'm going to stop sharing my screen and just, if you guys have any questions or if you have any comments, Amy and I are here for a little bit longer. We're happy to field those if you.
What are some of the subjects you guys have covered besides that?
Besides the 5 Ps, we've done a song on sepsis that goes over the steps of the sepsis bundle, how to identify sepsis. We did that one to the tune of Fever. That's currently being taught right now to our critical care concepts course. They've gone through the portion where there's no intervention and they've given a quiz, and we're soon going to be stepping in to do the live music intervention and then eventually recorded. And then again, Dr. Simon asked us to pull together a course about difficult airway, how to treat it, what the steps are, what the drugs are that you use. She's going to use that to present at a lot of her difficult airway workshops, which are all over the country. Those are our 3 current projects. And then the 2 fun ones we did for Experience Week.
We have had some informal conversations around ECMO and around
the TISC clinic. Our
clinic.
transgender intersex specialty care clinic asked us to possibly collaborate with them on a song about the proper way to take a sexual history with a patient that's in transition, and the 5 R's as well for culture of safety.
All coming down the pipeline.
That's right.
So, John, I see your question. I don't remember, did you say these were uploaded to YouTube? So they are not uploaded to YouTube right now. We are hoping, as with every institution, you know, there's certain guidelines and everything before we can release them out to the public. So we are in the process of hopefully getting them uploaded very soon and into our own internal learning system as well. But we're happy to share them with you guys if you would like.
Yeah, I was interested in whether they were available to use. If you said that you could share them, just because I think it would be a great way for our nursing students, you know, and a fun way for our nursing students to retain some of these concepts and
absolutely
introduce them to the topics, you know.
Absolutely. I know that we need to, that recording you just saw, the 5 Ps, was one that we had media services assist us with. Our other 2 recordings are kind of very homemade, just a camera in our OR with one of our employees up in the Sim Center recording. We want to get those into a more professional format before we release those, but we could absolutely send you this one on the 5 Ps.
That would be great. I'll put my email address.
Yeah, absolutely.
Well, we thank
So-
you guys for all your, oh, go ahead. Sorry, didn't mean to.
No,
was just,
I was about to say that Mayo Clinic has been working very hard, and those soft kind of skills, and I think this songwriting is going to help a lot, like bias and gender, microaggression. So I think with Amy, we were talking about something like that, and maybe they can work on the protocols for advanced life support or basic life support. So that kind of thing that we always keep in mind, like when you listen a song, like they were saying, we never forget and have the song the whole day in the mind. So that is actually the purpose on this kind of exercise. I think I love it.
If anybody here has a specific learning goal in mind, or you're getting ready to teach a course on a specific topic, or there's something that you need help with, you can absolutely reach out to Liz and myself. And while we're not sure where everybody is located, we're in Florida, but we do have the capacity to help you perhaps design a song, maybe even record it for you if you have a certain course coming up that you need some assistance with. That's kind of what we do. We call it Yankovicing the lyrics. We take a song, we change the words, we add your concepts, and we, make it in a catchy format so that it can become something you can use for teaching. I'm not sure what different organizations do as far as rounding, if you guys follow the 5 Ps or if that's in line with your protocol, but that's definitely one we can share. I think sepsis is kind of a generalized concept, and I think difficult airway is a generalized concept. So if either of those are something that you guys are interested in, or you have other ideas about other topics, let us know. We'd be glad to jump in and help you as we can, as our bandwidth allows.
And
Hey, I'm
Daisy,
sorry
I'll
if this
offer-
was,
Oh, sorry. Go ahead, Melissa.
I was going to say, I'm sorry if this was stated before, but I was curious, were these videos applied to your like hospital onboarding process as things that they view prior to getting on the floor, or is that just something that kind of got around?
The very
through-
first one was used during nursing and patient care technician orientation. So yes, they were exposed to it their first day at Mayo when they came in. The sepsis one is for more embedded nurses that are doing, they're already on the floor doing critical care and ICU treatment. And the sepsis bundle is obviously a very big concern. So many people die every year from sepsis. So Mayo is very focused on making sure that protocol is correct. So when we found out they were teaching that in critical care concepts, we said, well, did you know we have a sepsis song? And they said, well, we know now, and we want to use it, because they had been part of the process when we were doing the nursing. Nurses have been our most popular study group so far. They're the ones who have required or asked for the most help. So it's both. It's people that are new, and then people that have already been working for a while at Mayo. Hope that answers your question.
It really does. Actually, congratulations. I think this is brilliant.
Thank you.
Really well job. Really well, good job.
Thank you.
I think it's a fabulous idea. Anything you can do to help people remember things is always a positive.
Absolutely. If it's going to elevate patient care and improve safety and reduce risks of fall and adverse events, we're all about it.
out of
Which is interesting
curiosity,
that you guys also point out to the song, because I know when we're teaching ACLS at my organization, we do Row Row to Your Boat with shock, epi shock, amiodarone, and I didn't even think about
There
it.
you
until
go.
the point how
And we use Staying
catchy it is.
Alive, right? Well, you can't tell by the way I use my walk. That's 100 beats a minute for CPR, right? So we used it a little bit here and there. There's so many songs. I hate to say it, even Baby Shark is the right song
Yep.
when you're doing compressions. There's so many songs. If you Google songs that do 100 beats a minute, so many come up. So we kind of started using it a little bit here and there with nurses, and that was one of the beginning stages of this project.
out of curiosity, do you guys have a background in music? How do you guys get involved in this?
Yeah, so I'm a board certified music therapist. So I got my training at Florida State University here in Florida, got my board certification in 2015. And so I use not only music therapy with patients, but also with learners to help enhance. And then Amy,
She sings, plays the piano, plays the guitar. She's a wonder. I actually have a master's of fine arts in opera and classical voice from the New England Conservatory of Music in Boston. And I've done theater and musical theater for 30 plus years. So music has always been a very important part of my life.
Yeah, that makes me want to hire somebody with that background.
You
We never think,
absolutely
right?
should.
We never thought that you get a job at a healthcare facility because you have a music background. Well, we're opening
Right.
those doors.
Right.
Anything else? Anybody else have any other questions?
Any other question? I have seen, I look at here and then I don't know, Ricardo Hood. I love to see who, to meet them. Jane, I know, Pam Daly.
Hi. Hi, everyone. I'm from Valencia.
Hey,
Hi. Hi. Hey, Ricardo.
And hi, everyone. I'm Ricardo Hood. I'm actually in Antigua. I'm a professor of clinical medicine for American University of Antigua. So
amazing.
I'm a good friend of Mariano Liu. And so as he was starting, he invited me to join, and I'm happy to be part of this group.
Thanks for being here.
Thank you.
Well, we
I
so
know
appreciate you
this lady.
inviting us and having us and being such gracious, like, and warm and welcoming. So we just really appreciate being able to share what we're doing in our work, and happy to answer any further questions offline if you guys have any. But we do love what we do. So
Absolutely. Yep.
Thank you. And here's Melissa Morris. Do I know you, Melissa?
Yes. Hi, everyone. I'm Melissa Morris. I'm the director of SAM. Hi, Nelson. For the Dr. Pallavi Patel College of Healthcare Sciences at Nova Southeastern University in Fort Lauderdale.
Good to see you, Melissa.
Good to see you all too.
If you guys have any questions or any other concerns, or you want us to help you with a project, please just reach out to us. We'll put our email addresses in the chat here so you can get in touch with us if you need us. And we would be glad to collaborate or help you. And if you want those videos, just reach out to us. We'd be glad to get you that information and let you share at least the 5 Ps until we get the others polished up. You know, we got to make sure our hair looks good in the videos before we share them. Right? Thank you for having us, Daisy, and for inviting us to present
Of
today. We
course.
appreciate it.
Thank you, guys. That was fantastic. Well, they have to leave. So thank you very much, Liz and Amy. See you tomorrow.
We will. You'll see us tomorrow. Thank you, guys.
Bye,
We appreciate
everyone.
meeting guests.
Bye, guys.
With that, we conclude our sessions for today. I want to thank you, everybody, for participating, and look forward for our next session, news webinar for September. Okay, you should be getting an email on that. So have a good day, everybody.
Thank you.
Bye.
Bye, Melissa. Bye.
Okay.
Bye, everybody.
Have a good day.
You too. Thank you.